Hello, everybody. During the next few minutes, I will discuss how to speak to your patient as an IO, and I will mostly focus on what you should tell to your patient or discuss with your patient before the intervention, when you are in consultation and during the follow-up. I think even before you meet the patient for the first time in consultations, you have to know about the patient file and history. You need to look at this before. Is it the day previous? Is it in your consultation room alone? But I think it's never a good idea to look and study at file and images in front of the patients. If this is a new patient, he will find that you don't know his history and his file. And if it's for follow-up, the time you scroll down the images, you compare the pre, the post, will be very long to him because he's hardly waiting for results. So never look at file and images in front of a patient. I think it's not speaking, but it's very important. If you meet the patient for the first time, of course, you have to tell him who you are, what will be your role in these interventions, we're going to treat him, we're going to do the follow-up, and how you're going to do it. But most of the time, you have to make a small explanation of what is IO, because most of the patients, they know about radiation therapy, chemotherapy, surgery, but they have a little knowledge about what is IO. And then you have to go into what is the goal of the intervention that have been decided in the tumor board. And I think this is very important that all interventions are decided in the tumor board, and it will make patients more confident about that the file has been seen by medical oncologists, surgeon, radiation therapists, pain palliations physicians. So very important. And then you have to go into details. Is your intervention curative, or let's say locally curative, that you're going to treat one tumor and the other one will be left for surgery or radiation therapy? Or are we going for palliation? And then the patient will understand what is the goal of this intervention. And then you can go into technical details. But patient, most of the time, does not care that much about technical details, or at least this is coming as a second line. What the patient wants to know is how long he's going to stay at the hospital, what will be the type of anesthesia during treatments, and what could be the side effect, and of course, will he or she suffer from pain after the treatment, which I think is the three main concern of the patient. Of course, we can explain about image guidance, you can explain about technology, microwave, RF, TACE, embolizations, but probably not in too much details, because the most concern is the third one that I discussed. I recommend that you go into technical details. You can use drawings, very easy to explain many things. And we always give this drawing to the patient at the end of the consultation. Then they can better understand, they can discuss with the relative, and they can even explain to the relative what's going to be happen during the treatment. Of course, you have to speak about outcomes, and they are very interesting about what is the success rate, complete ablation in 90%, pain relief when you're talking about palliation in 70%, and very important. But I think that side effect should be a much longer discussion than success rate, because there is a lot to say about side effect, and I usually go for every single side effect. I give percent and severity. And for example, if I'm going for lung ablation, I will always discuss all the side effects, like bleeding, infection, pneumothorax, but also air embolism. I will explain it's very severe, but it's very rare. And I think at the end of the presentation of side effects, the patient will be slightly stressed. And then you have to finish with what will be the most likely scenario, which is probably an inpatient treatment or 24 hours at the hospital, very little side effect, and no major complications. That's going to be very reassuring to the patients. I think the most important part of your consultation is this one as well. You have to explain to the patient what oncology can offer at large, and not only what you can do as an IO. And I think you should be able to discuss chemotherapy, radiation therapy, and even more important, in the patient is in a scenario where you have neoadjuvant or adjuvant treatment. You should be able to explain what is the sequencing to the patient, that he better understand that all those treatments are combined for the best of his interest. And of course, you have to finish by, do you have any question about the intervention, your disease, what I'm doing? And I think this is a very important point. Some patients have the question list, some patients have no list. And I always recommend to the patient that if they come for the first consultation, they does not come alone, because it's always nice. I always say to the patient, you will understand 50% of what I will say. And if you are two of us, you're going to increase this percentage. Then we are moving to what you should do or what you should speak about during follow-up. And I think the first point is you have to do the follow-up of your interventions. Nobody can better explain to the patient what is the outcome. Nobody can understand better what is the images look like. So it's very important that you, as a physician, are following your own patient and you don't send back to the medical oncologist or to the surgeon. The first question is, how does it go? What's happened since the treatments that we performed 2 months ago? And is there any other consultation, any other treatment ongoing? Because you have to know if things have changed. I think it's very nice to show the patient the pre and post images, because you know about those images, you have seen them before, and you can discuss about ablation margin, size of ablation, and patient will be very happy to have the pre and post images in screen in front of it. And I think it's the outcome is positive. It's time to speak a little bit different. And I think it's very important to the patient that you start to speak a little bit about him or his family. And I think they will highly appreciate that you ask, what is his job? Does he plan for traveling? Because the next follow-up will be in 2 months, but he have planned for family events. We might postpone it. And this is a really nice time to have the patient. And I will be kind of very happy to answer your question if needed.